Today I shall talk on infliximab. The infliximab, the most widely used biological agent, it is actually anti-TNF antibody. Anti-TNF antibody. Various conditions it is used, like inflammatory bowel disease, ankylosing spondylitis, and so on. There is long list for infliximab. Today I will talk on very shortly on adverse effect and contraindication. There are very important adverse effect of infliximab. Number one, infection. Infliximab increase the risk of respiratory tract infection and urinary tract infection, and also increase the chance of opportunistic infection, and it also increase the risk of malignancy. Very important adverse effect. The long use of infliximab may increase the chance of malignancy. And as infliximab is used in IV route, so there are some infusion related reaction. Two type of reaction. One is immediate hypersensitivity reaction, and delayed hypersensitivity reaction. As the part of immediate hypersensitivity reaction, patient may suffer from pruritus, fever, chills, chest pain, hypotension, hypertension, dyspnea, or anaphylaxis, even convulsion. And delayed hypersensitivity reaction is due to actually a serum sickness. Very important point. Serum sickness occurs in infliximab, and due to this serum sickness, patient may feel myalgia or arthralgia. Now patient may feel severe or low grade headache. Infliximab increase the opportunistic infection, already I have said. It also causes hepatotoxicity. So the patient taking infliximab should be a regular follow-up with hepatic transaminase such as SGPT and SGOT. And heart failure. Actually, infliximab should not be given with moderate to severe heart failure, as because the infliximab around or more than 5 mg per kg body weight, if given, then it may aggravate the heart failure. And very important and interesting adverse effect of infliximab is it may cause demyelination in the central nervous system. Sometimes the patient taking infliximab may suffer multiple sclerosis, and it is due to demyelination. So this is called unmasking of multiple sclerosis, and sometimes it may cause GBS like symptom, Guillain-Barré syndrome. So these are the adverse effect, very important and high yield in any examination. Now the contraindication. The very important 3 contraindication of infliximab are active infection. No active infection should be. Okay. Number 2, the latent tuberculosis. Before giving infliximab, doctor should or must exclude any latent tuberculosis by screening test. And as I already said, the moderate to severe cardiac failure is the most important contraindication. So these are the contraindication. Now there are some pre-infusion checklist, that is prerequisite before giving infusion of infliximab. What are they? The number 1 is tuberculosis screening. That means you have to exclude that active or latent tuberculosis by tuberculin test, that is called AMT test, and gamma interferon assay, that is called quantiferon. Very important test over the last few years it is used, quantiferon. Actually quantiferon is gamma interferon assay test, and the old is gold, chest x-ray. By these three tests we have to exclude the tuberculosis, latent or active, and patient also should have screening for hepatitis B and C virus, hepatitis B and C virus, hepatitis E by HBsAg, and hepatitis C by anti-HCV, okay. And of course several times I have said the patient should not be case of moderate to severe heart failure. If patient is a case of moderate to severe heart failure and infliximab is a mandatory for that patient, then infliximab may be given with lower dose. The usual dose is 5 mg per kg body weight per dose. So if it is needed, absolutely needed in this patient, then lower dose may be given. Thank you very much.